Is uneven legs the reason for your back pain, or is it a total myth? Many people are told by chiropractors, physical therapists, and other doctors that this is the reason for their pain and it needs to be corrected. But is this true? In this video, I'm going to tell you how many people have a leg length inequality, how it affects your low back and your hips, how it affects your walking, how it affects your alignment, and ultimately what there is to do about it using heel lifts and 5 exercises that I'm going to give you today. My name is Dr. Grant Elliott, and we have helped thousands of people around the world fully recover from low back pain, disc herniation, and sciatica. And in this episode, number 136 of the Low Back Pain Podcast, I'm going to discuss with you exactly what the evidence says about this situation and what we did with many of our clients who had leg length inequalities. Real quick, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program, and immediately upon joining, you will receive our free step-by-step sciatica guide. This is the same process that we have taken thousands of our clients through around the world to identify exactly how to fix their sciatica and ultimately become pain-free through our one-on-one coaching program. In this group, you will be able to see our clients and what they're doing for success and additional resources and more free guides. So if you're serious about fixing your back, you need to join this group, RehabFix Low Back Program. See you soon. Leg length inequalities. Let's get right to it. First off, how many people have a leg length inequality? Let's define the population. Based on the current evidence, 90% of the population has a leg length inequality. 90%. That means generally only around 10% of people have even hips or even legs. So if 90% of people have an uneven leg, wouldn't that make it normal? Well, let's discuss more of that later. Now, the average inequality amongst the population is 5.2 millimeters. This is about half a centimeter. This is the average difference between most, 90%, of the population's leg lengths. And they tend to find that the taller the individual is, the greater the chance of discrepancy. Now, what about people with and without back pain? How does the leg length inequality affect people with back pain? Well, we have a study here that looked at 500 people with and without symptoms. And they found that the average leg length inequality from both of these groups was the same average amongst 90% of the population, around 5.2 millimeters. So this suggests that the average leg length inequality is not related to symptoms. One study showed that 247 individuals with and without low back pain were assessed, and the results showed that there was no increased risk of back pain with a leg length inequality of 10 to 20 millimeters. And the relationship between leg length inequality of more than 20 millimeters and back pain were not conclusive. So even going beyond to greater measurements still is not of significance. And even further, what they identified the commonality between those who did have a greater leg length inequality and did have pain is that it was not the degree of inequality that indicated risk of pain. In fact, they actually found that it may depend more on prolonged and repetitive loading of that individual. So they're starting to find that the degree of the leg length inequality amongst most of the population, the vast majority of the population, is not the factor that will influence one's degree of back pain or any pain for that matter. Rather, it's the combination of greater inequality and the addition of prolonged and repetitive loading. So in most scenarios, individuals in their adulthood are being told they have leg length inequalities. But what if you have a leg length inequality from birth, from day one? How is this scenario potentially different? Well, here's another study. When examining the effects of leg length inequality from childhood, there was a follow-up study of 81 patients with Perth's disease, which is a lack of blood supply to the head of your femur, which can result in some bone degeneration, therefore leading to an inequality on average of 12 millimeters. And they followed up on an average of 35 years, and they found that most of these patients had no back pain. and concluded that back pain was not a significant problem even after births, in spite of very frequent leg length inequalities. So birth-based leg length inequality, still not significant for developing back pain. In summary, childhood onset anatomic leg length inequality appears to have little clinical significance up to 20 millimeters. So this is the first time we're starting to hear that the cap for when we start to see discrepancies is around 20 millimeters. Now, for these unequal legs, many people will be given a heel lift or a wedge to even their legs up because they're told if they're walking all day, this can significantly affect their walking patterns, their gait, and it can lead to problems. But what does the evidence say about this? Let's look at it. One study found no significant differences in joint movement with the imposition of a 1¼ centimeter leg length differential through a shoe. What this tells us is that the body is able to compensate for most minor leg length deficiencies, and that a correction of this leg length deficiency for biomechanical reasons does not appear to be indicated. Another study of gait and leg length inequalities utilizing foot lifts found that a 2.3 centimeter lift produced no changes in gait or hip forces. Another study of subjects with pre-existing unequal legs found that a mean inequality of 2.5 centimeters was necessary to produce an asymmetrical gait. So much higher inequalities than most of the population has. Leg length deficiencies in children was only found to produce asymmetrical gaits in degrees greater than 2 centimeters. So with these higher degrees of inequality, it does become recommended in certain circumstances to try to equal the load by utilizing shoe lifts or heel lifts. Now, improving and correcting gait doesn't necessarily mean that that will be the determining factor for removing someone's pain. Someone can have a perfect gait, but also can have low back pain for other reasons. So if the main purpose of using a heel lift is to correct someone's gait, that does not necessarily mean it will correct their pain in other places. So how do leg length inequalities affect our alignment, right? The main reason that you hear chiropractors and physical therapists and other doctors throw out this leg length finding as a reason for someone's pain is because they say it puts you out of alignment and your body will start compensating and different muscles and joints will be used that don't want to be used, right? Compensation is the main thing. So what does the evidence say about this? When analyzing the effects on structure and causing muscular hypertonicity or changes in strength and coordination, one study found no difference between the unequal and equal leg length groups relative to muscle fatigue, neuromuscular control. They even examined muscular performance on trunk extension of these groups in young men with leg length inequalities of 10 to 15 millimeters, both with and without lifts to equalize the inequality. And there was no statistically significant effect of the lift and equalization of the legs on any of the variables tested. Standing balance was also examined of individuals with 9.5 millimeter leg length inequalities versus none, and there was no difference. So they concluded that individuals with anatomic leg length inequalities are not less stable than those without during quiet stance, and that the probable reason for this finding is long-term adaptation by the neuromuscular system to the leg length inequality. That is the key piece here. Long-term adaptation. Long-term adaptation to the neuromuscular system prevents us from having functional deficits. That is the key here. That is the key. Because one of the primary arguments is that, if you have an uneven leg, it's going to either be causing you a problem now, or it's going to cause you problems in the future. But this is not true. The evidence is abundant that this is not true. So before I tell you what you can do about it, because I want to give you solutions here, the summary of this is that 90% of the population has uneven legs. So having uneven legs is normal to 5 millimeters. Let's just say that. It is normal. Uneven legs is normal. The evidence proves it. It doesn't cause back pain. It's not a reason for biomechanical deficiencies. It's not causing a kinetic chain reaction in most cases. It does not require anything crazy. It is normal to have uneven legs as a kid later in life, up until 2 centimeters, but you're going to be just fine, and it is not a cause for concern. Now, what can we do about it? Yes, I am going to give you some action steps for what you can do, even though we realize it's not really a problem. That's actually step 1, is recognizing that this isn't likely your problem or the reason for your pain. And I don't want you chasing something that isn't a problem, an imaginary problem, because that is a problem that will create pain, that will create chronic pain, and that will lead you down the wrong paths of care. So do not chase something that is very, very unlikely the reason for your pain, unless you are someone with a significant leg length inequality, greater than 2, greater than 3 centimeters, which most likely, from a statistical standpoint, you don't. So don't chase an imaginary reason for your pain. It's time to swerve and get some different advice right now. Now let's pretend that this leg length inequality is related to your back pain, which it's, once again, most likely not, but let's pretend that it is. If we look back at the research that we reviewed here, we found that the main differentiating factor between people who experience pain and not is 1, the degree of the inefficiency, but 2, the ability to tolerate prolonged and repetitive load. So what we need to do is improve the function of your lower back, of your hips, to tolerate prolonged and repetitive load better. And here are 5 things that I'm going to show you today to improve the symptoms associated with a leg length inequality. The first is to work on RQLs. Many people with uneven hips might just feel like one QL is tighter than the other, or they were told that, one QL is very, very tight. So how can we normalize tone in the QL region? A tight muscle is often a weak muscle, and so we want to strengthen RQLs because most individuals are not strengthening them. So there's 2 ways that we can simply strengthen our QLs without any equipment at all. One is a silly one, but it is our butt walk. Essentially, what you do is you sit flat on the floor with your legs straight out in front of you, and you shuffle each hip one at a time, trying to walk forward just on your butt. So you're basically reaching with one leg and then pulling and then reaching with the other. You can also hang from a bar and raise one hip at a time, alternating the activation of your QLs. This is improving the control of your lower back. It's improving the control of your QLs, and it can help normalize tone as they gain awareness and strength. Now, if hanging from a bar is a difficult task or you don't have one, then you can also lay flat on your stomach or your back and practice alternating raising one hip at a time to improve this control and strength. Now, we also want to focus on our hips, improving the function of our hips as a whole. So here are 3 simple exercises to improve stability and range of motion of your hips. We're going to start with improving the range of motion. Many individuals who are sitting all day get a lot of hip flexion, but not much hip extension. So one easy way we can start to improve hip extension is through a mobilization with movement. You're going to get in a typical hip flexor stretch position, but you're not going to sit there and hold it statically. You're going to lunge in and out of it repetitively, pushing that hip further and further and further behind you into extension to help the joint improve its range of motion. This repetitive loading fashion is much better for enhancing range of motion overall and loading that joint a favorable direction, a direction that it commonly does not get. And usually exposing our joints to the directions that they do not get enough of is a very good idea. Now that we mobilize that hip into extension and helped stretch that hip flexor a little bit, now let's strengthen the hip flexor to help normalize tone in the front of the hip, because we want to improve function in all areas of the hip. And here are some simple action steps. Grab a band or a weight. Simply stand with the bands around your feet or the weight on one leg and raise it straight up like you're doing a knee raise. Perform this repetitively to strengthen the hip flexor, which will further help normalize tone in the front of your hip and might feel like you are loosening up a tight hip. This will help reduce pressure all around the pelvis as well. And then finally, let's improve the stability of our glutes and of our glute med and our external rotators by utilizing the exercise that I like, which I refer to as the knee side plank clamshell. It's a mouthful there, but basically, you're doing a side plank on your knees and performing a clamshell. However, you're not using the top leg for the clamshell. you are doing a clamshell with the bottom leg. So typical clamshell position, but you are doing the clamshell motion with the bottom leg. So you are picking up your entire body off the ground using that glute med and external rotators as they push into the floor. You can still raise the top leg in the clamshell fashion just to activate both sides a little bit better. And you can perform this on both sides, of course. Improving the stability and range of motion all around the hips will give you the best chance of success for improving any type of compensations or imbalances you might have around your lower back and your hips as a whole. So these are some methods and exercises that you can use to improve your situation. But once again, big picture here, the chances of the leg length inequality being the reason for your pain are slim to none unless you're in an extreme circumstance, which 90% of you are not. So if you're tired of hearing over and over again that your uneven legs or uneven hips or uneven whatever is the reason for your back pain, and you're just tired of spinning your tires and you're ready for some actual results, then work with us so that we can help give you an actual plan. We meet with people every single day who are tired of hearing about their uneven legs, and when we tell them that it basically doesn't exist, it's a breath of fresh air, and they feel like they have a whole new approach to focus on, and they can leave that burden in the past that led them astray. Let's get you the proper plan so you can start to see results immediately, and me and my team would love to work with you one-on-one and give you a clear path to success. Click the link below to work with us, and be sure to like this video as well so that we can help this video grow and reach more people who have also been told some potentially incorrect things about their leg lengths. Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.